In order to correctly diagnose a patient, you need to gain information from the patient. First off, you need info on the present illness of the patient, when it started, any change in diet or behavior, etc. Family history is also very important. From the family's history, you can learn if there are any genetic diseases that might affect the patient, or if the patient has been in close contact with any sick people. As you may already know, whenever you visit a doctor, they examine you. This will include a physical and questions. A doctor will be able to gain valuable info about how you are doing through this examination, but sometimes a doctor will need to run tests. This is because a doctor is not always able to see how your body is doing from the inside. After going over all of this info, a doctor will be able to diagnose a patient. In this video, we will go through this case using a real-life case. A 15-month-old presents with his mother to the clinic for his well-child visit. He is healthy with no previous concerns. When asked, the mother reports she has no concerns for today's visit, but on being asked routine development screening questions, she reveals that he's not saying any words and that this does cause some concern for her. There is no significant family history. The toddler has 2 healthy older siblings who are both healthy and live with the family. Both parents are healthy and no relatives have learning disabilities or developmental delays. The toddler is up to date on his routine vaccinations, and he will soon receive his 15-month vaccines. His weight is at the 40th percentile, his height is at the 50th percentile, and head circumference is at the 90th percentile. The pediatric evaluation of developmental status (PEDS) was given at 9 months of age and was negative for developmental delay. Other screening questions have always been within normal limits during previous visits. The only significant past medical history is 2 episodes of otitis media, which have both been treated. The toddler appears to be well-nourished and happy. His physical examination is unremarkable. A quick and brief developmental assessment finds that he is not speaking any words, only babbling. He does not say mama or papa, but can point to the things he wants and follows directions. He can use a spoon to feed himself and scribbles with a crayon. Per the mother, he is always busy and never sits still. Differential diagnoses include language delay, autism, and hearing loss. Language delay is the most likely diagnosis. Language should begin early. By 1 year of life, an infant should be able to make sounds, to get attention, and should have at least 1 or 2 words that are understandable. By age 2, a toddler should be able to put some words together in short sentences. Autism, though, is not an ideal diagnosis. This is because while autism does include language delay, social findings will also be involved, like avoidance of eye contact and hand flapping. Hearing loss would also most likely have been detected at birth screening and would be associated with illness. Until both autism and hearing loss are ruled out, language delay is the diagnosis. The toddler is referred to the State Developmental Assessment and Support Program. There, he will undergo a complete evaluation by a developmental pediatrician. He will also have an assessment to determine any social, gross, motor, fine motor, and/or language problems. From there, therapy might be a helpful option. The primary care provider will also continue to follow the child's developmental progress and his social skills during each well-child visit. Autism will also be screened for, even though it is difficult at this age. It will be screened for through MCHAT, which is a parent response tool that identifies typical features and behaviors of children with autism.